Welcome to Garden of Fertility. I am Opera Stella Telma, your fertility counselor. Today we are going to be talking about how to differentiate between abnormal and normal menstrual flow. But before I proceed, I would like you to subscribe to my channel. Turn on your notification button so that you will be notified anytime I upload a new video. Menstrual cycle is a natural flow on a female who are still in their fertile period. However, you may experience normal or abnormal menstrual cycle. We have four stages of menstrual cycle. Firstly is menstrual phase, when the blood is released from the vagina. Secondly, follicular stage. This is the phase of releasing of hormones before egg release. Thirdly, ovulation phase. This is a stage where the egg are being released. Lastly, the luteal phase. This phase is for preparation of pregnancy. Now, what are the difference between abnormal and normal menstrual cycle? Normal menstrual cycle in a woman. You need to know that monthly menstrual cycle is a hormonal cycle that prepares women for pregnancy. The estrogen and progesterone hormone level usually change at this stage of menstrual flow. Every woman's menstrual cycle varies. An average woman's normal menstrual cycle is 28 days. However, normal menstrual cycle may vary from 24 days to 35 days. Some women may have faster menstrual cycle from 21 days. Calculating the normal menstrual cycle is not difficult. You simply count from the first day of your menstrual flow to the next first day of your menstrual period. However, as women get older, they begin to experience shorter cycle. Some women experience regular menstruation. In a situation, they can predict their next menstrual flow and also their ovulation period. And there are also some women who experience irregular menstrual flow, who cannot predict their next menstrual flow or their ovulation period. The use of contraceptives such as birth pill control and spirals can affect menstrual cycle. Now we take it one after the other. Firstly, we handle about normal menstrual cycle. What are the signs of normal menstrual flow? Number one is blood color. The longer your period becomes, the darker the color is likely to be. Due to the effect of oxidation, the reaction of oxygen in the body. The normal blood cycle in menstrual flow is bright red. This happens because the uterus is actively contracting and bleeding. So when the menstrual cycle stays longer, it takes the uterus a longer time for it to shed off its linings. So the color of the menstrual flow becomes dark red or even clotted. Secondly, menstrual period. Generally, the length of menstrual time in a normal menstrual cycle of a woman is 3 to 7 days. Menstrual bleeding tends to be heavy in the first 2 days. An average woman will bleed at least 15 to 90 mils during the menstrual period. Some women may experience periods that are even shorter or longer. If it lasts more than 7 to 14 days or your period is heavy, you should see a doctor. You need a medical assistant. Thirdly, menstrual symptoms. Before entering the menstrual period, Some symptoms of premenstrual syndrome will begin to appear. The symptoms in question includes tenderness of the breast. Your breast feels softer and more painful. Pains or cramping in the lower abdominal area. Sleep disturbance. You feel hunger more often. Your stomach feels bad and your mood becomes worse. These are several signs of normal menstrual flow. Now we are going to be looking into abnormal menstrual cycle. As I said before, normal menstrual cycle can change with age. At the age of 40 or towards menopause transition, the menstrual cycle may become irregular. Abnormal menstrual cycle may stop for 1 or 2 months or become shorter. Here are the signs of abnormal menstrual flow. Number 1 is mixing period or stopping altogether. 2. Irregular period or menstruation. Menstrual period longer than 7 days. Menstrual cycle less than 21 days or more than 35 days. 5. Experiencing heavy bleeding during menstruation. Apart from menopause, there are some other causes that can make a woman to experience abnormal menstrual flow. Some of the causes of abnormal menstrual flow include stress, lifestyle, uterine myoma, that is fibroid, endometriosis, polycystic ovarian syndrome, and pelvic inflammatory diseases. Consult your doctor so that your problem can be solved immediately. When to see your doctor if you are having abnormal menstrual flow. When you begin to notice irregularities in your previous normal menstruation, you should also consult your doctor if you are seeing the following symptoms. 1. Severe pains during menstruation. 2. Unusual heavy bleeding or large clots in the menstruation. 3. Abnormal or foul smell vaginal discharge. 4. High fever. 5. Menstruation lasts longer than usual. 6. Bleeding or spotting outside menstruation. 7. Nausea or vomiting during menstruation. Don't delay in seeing your doctor if your menstruation is abnormal. Please don't take that risk or gaze or either taking any self-medication that may cause more harm than good for you. To avoid future circumstances, you need to do the needful by following the right step. Consulting your health professional, you can meet your gynecologist, your fertility counselor, other health care provider. They can help you and advise you on what to do for you to get the right results. If left unchecked and untreated, the risk factor attached to it may increase and worsen the whole situation. So, take the right step for you to get the right results. If you find this section informative, please don't forget to like, share, and comment on this video. Drop your question in the comment section. I personally will reply you. Thank you for watching.